We're Kitchen Table, a healthy, frozen food startup. Our mission is to create value, improve health outcomes, and reduce food waste. The United States is the wealthiest country in the world today, one of the most educated, and spends more on health than any other nation. Yet, we rank 34th in the world in life expectancy of our population. Kitchen Table wants to make it easier for all people to eat healthy meals with frozen, plant-based meal kits that are available right in the grocery store.
Kitchen Table's plant-based meal kits will contain 2 servings of chopped, prepped, whole vegetables, grains, proteins, and spices, whole foods that are flash frozen to preserve nutrients and flavor. So why frozen? The Agricultural Research Center, as well as numerous academic studies, have shown that frozen produce actually has higher levels of nutrients than fresh produce, which is picked well before it's ripe to withstand long transport. Cooking our meal kits takes 30% of the time that it would take to prepare a full meal from raw ingredients, and we know this because we've tested this in our own home kitchens and with a sample of end consumers.
Today, over 100,000 Africans die every year from using counterfeit medicines. Most of the counterfeit medicines distributed in Nigeria are mostly sourced by neighborhood pharmacies from open drug markets. Our healthcare distribution solution is targeted at the 3.8 million low to middle income households. Most of this group of people are the ones that are disproportionately affected, essentially because of their socio-economic status.
The platform we've chosen is the smartphone. The reason why we chose it because it is the most piece of technology that most people will have. The pharmacist logs in securely, looks for a particular drug they want to search for, finds it, finds the specific concentration. At this stage, they should be able to see which particular manufacturer they want to go with and submit the order.
Ultimately, over the next 5 years, myself and Ankru envision that we will create an entirely new healthcare distribution platform for bringing safe medicines to developing communities in Africa.
We believe in Pub Forum, an app with a heartbeat, the strongest source of handheld information in the face of a devastating public health and education crisis. Today, that crisis is Zika. For nearly 1.5 million people, answers and comfort are currently out of reach. So we created Pub Forum, a content and communication app designed for people like Marina. Marina lives in rural, impoverished northeastern Brazil. She had Zika early in her pregnancy and barely recognized the mild symptoms.
Pub Forum is the only mobile app that brings together dedicated providers and accessible, verified information all in one safe space. It has 3 simple functions: forums, private chat, and an interactive content map. Now the forum is the heart of this app. It is a support network, so they can see the discussions happening around the issues that they really care about. And the private chat creates the one-on-one connection so that the doctor-patient relationship doesn't have to end when the patient leaves the doctor's office. Our interactive map is a visual feed of articles, videos, and other resources, creating a user experience rather than just a simple fact sheet.
1 in 5 Americans struggle with depression. Psychiatrists and primary care physicians resort to a long process of trial and error in prescribing antidepressants. This process has enormous financial consequences. We've developed a product that can potentially recover $2.9 billion that would otherwise be spent on ineffective prescriptions.
Imagine if April's friend Amanda had gone to Yale Student Health and in the waiting room receives a quick questionnaire on an iPad. She answers some questions about her experiences over the last 2 weeks, and her symptoms suggest that she has depression. The iPad then matches her to the antidepressant or therapy that is most likely to work for her, and a personalized report is compiled and sent directly to her clinician. The clinician then sees her and goes over the report with her and prescribes our recommended treatment. So how do we make these recommendations? First, we took the largest ever clinical trial of depression and extracted all the information that was available about these patients from their medical records. Next, we used machine learning to reduce this information, developing a brief questionnaire. Then we trained another machine learning algorithm, this time to look through the questionnaire and identify patterns of information that predict whether a specific patient will respond to a specific medication. But most of all, we help patients recover sooner, try fewer drugs, save their own costs of healthcare, and ultimately return to healthy life sooner.